Abnormal right subclavian artery. Proximal part of right arch artery is not contributing to form right subclavian artery. Distal part of right fourth arch artery persists. It's not obliterated. Therefore, in this case, abnormal right subclavian artery is contributed by distal part of right fourth arch artery, right seventh cervical intersegmental artery. This abnormal right subclavian artery runs behind the esophagus and compresses it. This causes dysphagia lusoria. Dysphagia lusoria. Double arch aortic arch. Double aortic arch is formed because of distal part of right dorsal aorta does not disappear. Distal aortic arch is formed because of distal part of right dorsal aorta does not disappear. Therefore, there is additional formation of abnormal right aortic arch with a normal left aortic arch. This abnormal right aortic arch goes behind the trachea and esophagus and compresses on them. This causes difficulty in breathing and swallowing. Trigeminal nerve. Trigeminal ganglion. It has the neuron bodies for three branches of trigeminal nerve. Three branches of trigeminal nerve. Ophthalmic branch, maxillary branch, mandibular branch. Ophthalmic branch, cranial nerve 5-3. It goes towards the orbit. It has three sensory branches: lacrimal nerve, frontal nerve, nasociliary nerve. They pass through superior orbital fissure. These sensory branches supply forehead region and the tip of nose. What are those three sensory branches? Lacrimal nerve, frontal nerve, nasociliary nerve. Ciliary ganglion is topographically related with ophthalmic nerve. Ciliary ganglion is functionally related with oculomotor nerve. Ciliary ganglion sends postganglionic fibers towards the ciliary muscle to increase lens convexity for accommodation reflex. Sphincter pupillae muscle for meiosis, light reflex. Maxillary nerve. It goes towards the maxilla. It passes through foramen rotundum and enters pterygopalatine fossa. Here the maxillary nerve is related to pterygopalatine ganglion. Pterygopalatine ganglion is topographically related to maxillary nerve and functionally related to facial nerve. Pterygopalatine ganglion sends postganglionic fibers to lacrimal, nasal and palatine glands. Branches of maxillary nerve. Posterior superior alveolar nerve supplies upper molars. Infraorbital nerve. Infraorbital nerve is the continuation of maxillary nerve. It passes through the inferior orbital fissure in floor of orbit. Upper teeth and the maxillary sinus are supplied by inferior orbital nerve. Premolars and anterior upper teeth supplied by anterior superior and middle superior alveolar branches of infraorbital nerve. Mandibular nerve. Cranial nerve 5-3. It goes towards the mandible. It passes through foramen ovale. Branches of mandibular nerve. Auriculotemporal nerve, lingual nerve, inferior alveolar nerve. Otic ganglion. It is deeper and more medial to mandibular nerve. It is topographically related to mandibular nerve. It is functionally related to glossopharyngeal nerve. Most ganglionic fibers from otic ganglion are carried by auriculotemporal nerve. It controls parotid salivary gland. Submandibular ganglion. It is topographically related to mandibular nerve. It is functionally related to facial nerve. Postganglionic fibers from submandibular ganglion are carried by lingual nerve. It controls the sublingual salivary gland and submandibular salivary gland. Ganglion, topographical nerve, functional nerve. It will be discussed in next video.